Let's talk about neuroscience and telemental health. And to discuss this, I am really glad to have with us Dr. Jennifer Sweeton. She is a clinical and forensic psychologist, an Amazon #1 best-selling author in clinical psychology, and internationally recognized expert on trauma and the neuroscience of mental health. So, Dr. Sweeton, thank you so much for joining me.
Thanks for having me.
Yeah, and I'm very interested in this topic. This is what we do, telemental health. And what's the impact of using technology on therapy or just relationships and connecting? So we think about like when people are connecting, communicating, when they're sitting across the room from each other, sitting in the same space versus video calls or audio calls or
Right.
text-based, like what difference does it make? And then like, is it based upon the individual? Like I know everyone seems to have their own preferences and so forth. So you're the expert on neuroscience, the brain and mirror neurons and so forth. And you've looked at the research. So I'm really interested in your perspective on this. But just let me backtrack a little bit because I'm interested in how you got into the field, how you got interested in neuroscience, right, as
Mm.
a behavioral health professional, because you've done a lot in your career. So maybe we could start there in terms of what got you interested in this specific niche of mental health.
Yeah, I actually started off in neuroscience and not really mental health. So I originally went to graduate school for was personality psychology, but really a basic science program and neuroscience. And so what I studied was affective neuroscience, which is essentially emotion in the brain. So it's related to mental health conditions, but it really wasn't me becoming a psychologist or a therapist at that point. But getting more into brain science and more into translational research, so how we can use that brain science to actually apply it to people, the more interested I got in the clinical side. So got trained in neuroscience and then actually made the transition to clinical and forensic, eventually forensic psychology. So I would say my interest in the brain predates my interest in clinical psych.
Yeah, and where'd that interest in the brain come from?
Oh
What
man.
got you interested in that or motivated to keep in that
Yeah.
field?
So I really think it's something that everybody would be interested in if they were exposed to it more. In terms of what I was doing personally, when I was in college, I was a computer engineering major. And so that's what I did. And at some point, I grabbed my roommate's psychology book, and it was like a chapter on the brain. And it was just such interesting stuff. It made engineering not seem as interesting, at least to me at that point. Although, yeah, I think there's a good intersection there between the two. So I actually decided to change into cognitive science, cognitive psychology, and kind of went in that direction.
Hmm. Yeah, neuroscience is fascinating. When I think of neuroscience, I think of the stars. And I think it's because people make the analogy of the stars and the neurons in our brain. Like there's, at least as many neurons in our brain as the stars possibly. And yeah, it's, and then also in terms of the stars in science, we're like constantly looking out into that frontier, trying to learn more and figure it out. And it seems like sometimes we figure things out and then we're like, oh, wait a second, no, we weren't correct on that, it's really like this. So
Constantly evolving, yes.
yeah, yeah, it's super fascinating. And then like the complexity, and when you talk about being a computer science, um yeah, like the brain is so amazing and proficient and like fast and complicated. It's uh it's it's really fascinating.
I
um
agree. I've thought the only thing just as interesting as the brain is actually space. Probably.
yeah, and it seems like the brain is a lot more fascinating. It's like
Mhm.
so like organic, and yeah, it's really interesting. uh so in terms of um two brains communicating to each other verbally and non-verbally, and like And then people talk about just the energy in the room and the connection people make. It's absolutely fascinating, and I think we're just going to continue learning more and more and more about this. So maybe you can speak about just the fundamentals of two people connecting through communication, mirror neurons, or how that works, and then we can talk about the impact of technology on that, how that kind of changes it a bit.
Yeah. So a lot of this is science, but some of it is still, to some extent, kind of theoretical. We know probably more about mirror neurons in animals, primates in particular, than humans. And this is kind of the way it always is with brain science, where we get some information and we form stories around that information, and then we get more information, we integrate it, and the story shifts over time. But here's where I think we are generally with it right now. Is that we all have neurons. We all know that. We have, what is it? Something like 100 billion or something. Many, 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 many neurons in your brain. And they're constantly firing. And the firing of the neurons is what causes, the networks to light up, the pathways to light up. But there are these neurons that I guess just kind of appear like any other neuron, but they're special and they behave a little bit differently. And these are called mirror neurons. Difficult thing about mirror neurons for studying them is that it's not like they're showing up like in like hot pink or something. They don't announce themselves as being different, but they behave differently, and it's kind of difficult to design these studies to really capture it. But in a sense, what they're doing is they are attuning to other people, and maybe attuning to animals too. So the really famous study was done in Italy, originally back in the early 1990s. And what it was a basic science monkey lab. And all they were doing in the lab was looking at the monkeys' brains and what was lighting up in their brains or activating when the monkey was moving their body. So this is the motor strip, which kind of goes like a headband across your head. So all they were doing is mapping this out, where monkey might move its arm. Okay, it lights up here. Now we know where it lights up. So very, very basic. We weren't thinking about social cognition or anything, really at that time. So what happened one day in the lab is a graduate student went out to eat lunch. He comes back into the lab. And when he comes back to the lab, he's eating ice cream. And when he walks into the lab, the monkey stops and looks at him really intensely. And I kind of compare this to like if you have a dog and your dog, you're eating popcorn on movie night, your dog is like, staring at you, kind of waiting. This is what the monkey was doing, just really staring at him, not moving at all, though, not moving his body at all, staring. And the researchers noted that when that was happening, the monkey's brain was activating as though the monkey himself were eating the ice cream, going through the motor motions of eating the ice cream, which was very bizarre because until then, we didn't think that the motor strip would light up unless you were moving. But then we found out, okay, it actually can activate when you're doing something, but also when you're watching someone else do something. So the movement of that person was activating, essentially shifting in some way, the monkey's brain. So this is what we think the basis of attunement is. And what's kind of cool is that it's not just in the motor strip, but it's also in the sensory strip, which is probably why when you watch a really, gory, scary movie around Halloween and, somebody's about to get stabbed, you cringe. Even though you're not the one getting stabbed, there's some piece of, you can think about it as like empathy. On some level, you begin to almost feel it, just not physically. And we found out that there are probably mirror neurons in emotional centers of the brain, such as the insula. So the insula is an area of the brain that allows you to feel into your own body. It also has mirror neurons, though. So what that means is that it will begin to mirror maybe what someone else is feeling. So for instance, if you have someone, it's kind of gross, but if you have kids, you kind of understand this, someone vomiting in front of you, you might all of a sudden feel like you want to vomit. So that's it's kind of like an empathy response. It's a mirroring response. And so we see that at the physical level, but also at the emotional level. So we think about this as the basis of attunement and of empathy.
Yeah. And how does that impact communication? Like when
Mm.
two people are conversing?
Yeah, well, what I think it means, and as therapists, we talk about this. Normal people don't talk about this, but I think what it means is that the communication is always deeper than whatever the content is. There's the content, and then there's the process, or there's what's happening between the lines. And I would argue that what's happening between the lines, or the energy of the room, or whatever that nonverbal communication is going to be a lot more powerful than the words that are coming out of your mouth. So I would say it's shaping our interactions all the time without us knowing it.
Yeah. And yeah, then when we look at, telecommunication, had they looked at, when you say it's the nonverbal, um, what's having more of an impact, the actual word said, the visual piece, or the paralanguage? Um,
Hmm.
like, yeah, what's really triggering those? I mean, they're probably all triggering the mirror neurons. What's said, what's the context, yeah, what's the situation, what's visual to the person, what can they heat, what are the actual words, and what's the paralanguage, the tone, pitch, pace, all
Yeah,
that sort of stuff.
totally.
Yeah, any research on that?
Okay, so we know how mirror neurons are activated. That sounds like it's kind
Mhm.
of the question. It's
Mhm.
going to be through eye contact, and then through, you're calling it paralanguage, but yeah, prosody. It's through hearing, essentially. So
Mhm.
what you're hearing, you can activate mirror neurons through that, through vision, and then through physical touch. So, as therapists, we're not usually touching people. Most therapies are not touching people. So usually in a therapy context, it's the eye contact, and or it's hearing the sound of someone's voice. And so really, you can build that attunement, build that alliance with the client, even, by phone. I know that there's been a lot of resistance to this, and even a lot of resistance to telemental health, until the pandemic. And then all of a sudden we're kind of thrust into this world, a lot of us, where it's that or nothing. And we know that that's better than nothing. But really the research does support doing therapy in this way. We know we
Mhm.
can still activate those mirror neurons.
Yeah. So what are some tips that you have for building that connection and attunement,
Mm.
with the individual? Um, and another piece of this I think about is people are individuals. They have their own preferences. Some people will kind of disconnect themselves with the person they're communicating with when they're
Mm.
in the same room because they're overwhelmed,
Great
or
point.
through video because they'll just see them as like, just a computer and not really there, and they can just go into their own head. um, some people over the phone feel like they can get really in tune with the person over the phone because they're not distracted by all the visuals. But then other people, maybe over the phone, feel a little disconnected because they connect through the visuals. So yeah, any like tools, tips, and thoughts on the individual piece of it?
Yeah, probably a lot. So I'd say the first thing is, and this is consistent with research, you go, if you can, with what people's preferences are. So
Mhm.
therapists who don't want to do it, who don't think it's going to work well, it probably won't work as well. It changes your behavior in a session if you think what you're doing is not going to be effective, right? So, there's that aspect. If a client really doesn't want, video teleconferencing, then I would say don't do it unless you absolutely have to do it. But I think there's pros and cons and tips to go with kind of all of it. I think a perk for doing it via video, or especially phone, is that people don't have to be as self-conscious about themselves, their whole body. So you're not having to think about, like, okay, is my, pants bunched up here? Am I, all that can go away, especially with phone. And that actually frees your attentional resources to focus on whatever you're trying to focus on. So that's one piece of it. Of course, a downside to that with therapists, if we're doing, video or phone, is we're not getting a whole picture of body language. So we may not be able to see breathing much, for instance. We may miss a tapping of the foot or muscle tension. So that's a little bit of the downside. It can also be a little bit difficult on video, if your camera is situated to where, and I've seen people do this, where like the camera's over here and this other screen and they're looking over here. So you're not even getting close to eye contact. So a tip is to try to get your camera, like I kind of have you right now, like your head kind of close to the camera. You want to get those as close as possible. You're always going to be a little bit misattuned with eye contact as long as you're doing, teletherapy, but you can get much closer, which is going to help the alliance. And of course, lighting is important. In the pandemic, I mean, I was seeing people, in their cars and their backyards and their closets trying to get away from their kids. I mean, we didn't exactly have the best connections and lighting, but ideally it'd be kind of like you and I are right now, where we can see each other pretty clearly. We can read facial expressions. We can see some of each other's body language. To your point about, people may, not really wanting to be in person with someone that might feel more guarded. I have found that to be especially true with trauma survivors. Some people in the office, I can always tell by where they sit in terms of like kind of what their attachment's going to be. Some people want to sit really close to me, but a lot of trauma survivors want to be across the room. That's where they feel a little bit more comfortable and more safe. And so when you take out the person-to-person bit, especially if they have, developmental trauma, attachment trauma, they seem to disclose more, I've noticed, via telemental health, and especially on the phone, which makes me, I've thought a lot about this, just about the old psychoanalytic days and psychoanalysis. And you're put on the couch and you're facing away from the psychologist. You're never making eye contact. It's only what you're hearing. And that was done on purpose to not interfere with the client's experience. And that might not be consistent with all of our orientations, but there's probably a place for that. And actually my own therapist, very analytic, psychodynamic, and we talk by phone. And I've joked that I think that is her way of like putting me on the couch, essentially. So, I think sometimes people can disclose more that way, feel more comfortable, but it can also cause a little bit of a disconnect.
Yeah, I think one question for therapists is, do you want the client to go internal? Do you want them to be focused on themselves, their thoughts, their feelings, their daydreaming, right? Just exploration internally? Or do you want them to be really tuned into you and the connection and the relationship between the therapist and client? So like with psychoanalysis, it's not about the connection really. You don't have that connection between the therapist and client. It's letting them free associate, go where their mind goes. And another thing I think about is preoccupation. So I wonder, I would assume that it's hard for people to connect with one another if they're preoccupied.
Mm-hmm.
So like in a when meeting with a group of people, there's one technique that sometimes people use where they'll ask everyone to tune into themselves and to notice whether or not they have anything distracting them from being present with those in the meeting right now, right here. Thinking about something going on at home, or a to-do list, or how they're impacting, like, being self-conscious, whatever it is, identifying the distractions, how they're preoccupied, and then going through a process of letting go of those preoccupations, distractions, so they could be really fully present with those that they're with. So, I kind of wonder, with using technology, how we can have distractions. So like therapists talking to the client about finding a space where they won't be distracted, like worried about someone overhearing them, or noise behind the door, or seeing themselves through video. Like most video conferencing systems, you can see yourself and the person you're talking to. And for most people, that's very distracting. Or if you have poor audio quality and you can't quite hear them that well, that's quite distracting. Like,
Mhm.
I wonder if setting up an environment where you're really eliminating distractions to allow for being fully present. Yeah, but if any thoughts on that?
Yeah, I think it's really important. And actually, you probably just heard the ding, like that was
Yeah, yeah,
an email come in that I didn't close
yeah.
out.
Distraction.
A little bit, yeah, right.
Yeah,
And so, some amount of that stuff is probably going to happen. And you could argue, even in a therapist's office, there's some amount of it. If you hear a
yeah,
guy walking on the roof, so maybe it'll always be there to some extent, but minimizing it is good. I do think there's kind of a difference between, like, and this kind of relates to mirror neurons, a shared distraction versus one that's not. So if you have a client in session, but they're actually like watching their dog and they're checking their emails while, supposedly engaging with you, I do think that's different than when you're in an office together and you hear something together and you say, oh, did you hear that? Like, there's some point of connection about the distraction, or, oh, is that too loud?
yes,
Rather than the kind of the separate distractions that you're going to get a lot in telehealth. Yeah, I think that
yeah,
can pull people away from each
yeah.
other.
So like a tip there is, if there is anything like that going on in on your end, to inform the person you're communicating with, to let them know,
Yeah, exactly.
to
Yeah,
let them be a part of it.
exactly. That's
Oh,
right. That's right.
there's this yellow fluffy cat walking across the window. Let me show you. I'm sorry, it just pulled me away
Yeah.
for a minute. I'm back with you. Uh,
Mhm.
yeah,
Absolutely. Yeah,
yeah,
yeah. Seeing the cats of the pandemic and all the cat butts, going across the
yeah.
screen for the last couple of years. Yeah, I think
Right,
that's a good point. Yeah, we want the shared experiences.
right. Yeah, very interesting. Yeah, and then in terms, it's kind of like entering the mirror neuron idea is kind of like entering the other person's world or perspective in a way, right?
Mhm. Right,
Yeah. So
right.
different situations, I think, call for a different way of being present.
Yes.
Yeah, like in a trauma, like I worked as in hospitals and emergency rooms a lot. So in a trauma, uh, for emotional support, it was so important to be right there in the room, standing side by side with the person.
Yeah,
Uh, yeah, really entering their physical environment at that moment was really important.
right. Yeah, and
Yeah,
getting the mirror neuron activation from aligned eye contact and hearing
yeah,
can
yeah.
be powerful.
But
Yeah.
maybe if someone is more in their cognitive world of thinking about ideas, you can collaborate on ideas through text,
Uh-huh.
writing back and forth, or
Right.
so it may have to do with context, and yeah, what the goal is.
Absolutely. Absolutely. And
Yeah.
I haven't seen any research on this, but my best guess would be text is better than nothing at all.
Mhm.
It's some point of communication.
Yeah, like going back to Freud, a lot of Freud's psychoanalysis was done through letter writing. That's how
Hmm.
we know so much about it, because of
Right.
all the letters and and sometimes people feel so connected and touched when they receive a handwritten letter.
Oh, yeah. Uh-huh. Right.
Yeah. And there's research on this in behavioral health too, like helping those with thoughts of suicide, uh, they call it a care note, getting a care note from the therapist after
Yeah.
treatment. Like just a one text message, like really makes them feel like, wow, I really am cared for. Like
Yes.
they do care.
Right.
Yeah.
Right.
Yeah.
Yeah, I imagine if what's happening is, that you start to imagine the words, or like you see the well wishes, and you imagine the therapist. You almost hear them saying it,
Oh,
or
right.
you imagine seeing them. Like almost like we're translating it into some form that would activate mirror neurons. And we know we can
Yeah.
activate mirror neurons even just through imagination. So
Yeah.
that's interesting.
Yeah. So a thing that would be interesting, like research wise, is how accurate is our empathy or mirror neurons? Um,
Yeah.
because we can be confused. Like what might look like the ice cream idea
Uh-huh.
with the monkey. It might look like delicious ice cream, but it might be really nasty tasting stuff
Mhm.
because you're not actually
Right.
tasting it yourself.
Right. Right. Uh-huh. Yeah.
I don't
Yeah.
know. This is an idea because I know sometimes we think someone feels a certain way. As therapists, we always we try to check in with the client to see whether or not our assumptions are accurate.
Right.
Like,
I think you and I talked about.
seems like that would be really sad. Did it impact you that way, or how was it for you?
Yeah.
I'm
Yeah.
feeling sad hearing that, but how was it for you?
Because we assume we know, right?
Yeah,
And I think about like David Byrne's work, and just that we don't know as much as we think we do. It
yeah,
doesn't mean that we can't attune to clients, and obviously if they're feeling really sad on the
right.
phone, not that we can't pick up on that. But sometimes I think our own perceptions can kind of dominate. There is this idea with with mirror neurons and maybe social psychology more broadly, that the person in the room who holds the most power, who's ever considered highest on the hierarchy, most in control, is the one who tends to dominate in a room. And so there's been kind of cool research showing that that person seems to put on others whatever they're feeling. And in the process, they lose connection with what those other people are actually feeling.
Oh yeah,
So if you ask like a CEO about an employee and what they're feeling, they're more
sure.
likely to be inaccurate. But if you ask the employee what the CEO is feeling, they're attuned, right? So we tend to
Nice.
attune upward, which I also wonder if sometimes with the power differentials in therapy, if that's a piece of what's going on,
Yeah,
is that we're assuming we know, but really we're not in the position to be able to best know.
right. It makes me think of the role that we play in the conversation. So, like in that scenario, I think like as the employee, the assumed role is for me to take on what the CEO wants to
To absorb.
happen.
Yes.
Yeah. And the CEO does not see it as their role to take on what the employee wants. Not that it should be that way.
Right.
Yeah.
But
And then
yeah,
in therapy, like the clinician's role is to really be in tune and try to really activate their empathy for the client, but not vice versa. The clinician actually tries to protect the client from taking on what the clinician feels. So like
yeah,
it's like that role designation sounds like plays a big part.
big
Yeah.
time. I think it does.
Yeah. Very interesting. Well, this has been very helpful. Really hope to have you back.
Yes,
Thank you for all the work that you do and investigating research and really helping out the field in this way. Yeah.
sure.
So yeah, thanks a lot, Dr. Sweeton.
Okay, thank you so much for having me.